Probably lots of questions because I still think there's a growing maturity in this space and for health systems and health plans. But one of the questions that they're not asking is, how do they treat their interventions in solving the problem like a portfolio? And what I mean by that is, it's too often for organizations to think about sort of one piece of the problem and one small solution, as opposed to, again, a much broader. I'll give you an example. So a number of especially the health plans that we work with today are really interested in food as medicine for certain populations, say maternal health, or those individuals who are recently discharged from the hospital, or individuals, maybe members and patients that have diabetes, right, as a primary disease. And so they want to embark on a food as medicine strategy and intervention. The challenge is it's not a one size fits all. Like, the best way to start to think about this, and the way that Social Risk Insights, and specifically the way that we do it at Socially Determined, the whole goal is to look at the full population. And let's take a disease like diabetes. So look at everybody with diabetes. They don't all need the same food as medicine strategy. So you first are segmenting the population to look at those folks with food insecurity. Is it food plus transportation maybe, or health literacy? And then aligning that with the healthcare data to understand exactly what financial opportunity is. It change in utilization patterns? Is it quality measure attainment? And then thinking about the cost of specific interventions that would mitigate the risk that those patients have, members have. And so what that can look like is almost like a concentric circle model. So you might have the highest need, highest risk with the greatest financial opportunity, individuals at that center of the circle where a medically tailored meal strategy might work and make the most sense. But it's also the most expensive intervention. So you've really got to be focused on the right subset of the population. The next layer out, maybe that's around addressing affordability for individuals related to either groceries or meals. Less costly, you can touch more members, and then you keep going. And maybe, the next is referrals to community-based resources, whether those are food-based programs, food pantries, food banks. Again, much lower cost, much higher touch across lots of individuals. And maybe that outer circle is just an awareness campaign about all the resources available to an individual, including the benefits as part of their health plan and the community resources. And if you start to think about that as a portfolio, then you can start to match the right individuals, the right subset of individuals with the right intervention, and expect to be able to drive more tangible return on investment dollars as part of those investments if you get right intervention to the right person.